Thousands of children and families in Marion County struggle with issues like poverty, substance abuse, or mental and emotional illness. Many local services exist to help families in crisis, but families often don't know about these services or can't get to them. Unmet needs can result in child abuse, neglect, or juvenile delinquency. The Early Intervention Planning Council, through the Marion County Commission on Youth's Early Intervention and Prevention Initiative, has created a plan to give families earlier access to services in the hopes of reducing the number of children who get abused or neglected or turn to delinquent acts. We hope you enjoy our monthly program, Our Kids, Our Families, Our Communities, and learn more about the local services here to help you.
Hello, my name is Shana Martin, and I'm the Director of the Early Intervention and Prevention Initiative at McCoy. Thank you for tuning in to another episode of Our Kids, Our Families, Our Communities. This segment is all about prenatal care and taking care of babies from the time we know that they're coming and until they arrive. And our guests today are with Goodwill's Nurse Family Partnership Program. We actually have a nurse, Mackenzie, who will talk a little bit about her role. And then we have a soon-to-be mom, Amber, who's going to talk a little bit about her experience working with Mackenzie and the Nurse Family Partnership Program. So, Mackenzie, I'm going to let you introduce yourself and talk a little bit about what you do.
Yeah, I'm a nurse with Goodwill Industries Greater Indiana Nurse Family Partnership Program, and we're a home visiting program for first-time moms, and we meet throughout their pregnancy until the baby's 2. We are our goal is to obviously support the families and the mom, the new mom, and to create a healthy and environment to support them as they grow and as the child is growing in that very developmentally critical years of their life.
Okay. Thank you for being here. Appreciate it. Amber, you want to tell us a little bit about you and your new little one that's soon to arrive?
I'm Amber. I'm a new mom, first time, 38 weeks pregnant. So anytime now with a baby girl. Okay. And I've been with Mackenzie since 8 weeks of this pregnancy. She's helped me through a lot. I was adopted, and my adopted mom never, had the opportunity of having kids. So Mackenzie has really helped me out tremendously, like with information and just all kinds of different things that my mom would not have been able to help me out with. So it's been an awesome experience having her.
Okay, great. So how often do you see Mackenzie and spend time with her?
Well, we first started out like every other week, but we're seeing each other like every week now. Every week. It's getting closer. So.
Okay. And so prenatal care, what is it?
It's important.
Okay.
It is going to your doctor.
Okay. And how often and at what points did you start doing that, and what's the expectations?
Do you want to share or do you want me to?
You can.
Okay. When I first meet with a mom, I share with them kind of the guidelines of what the doctors recommend for seeing for seeing them. So early in their pregnancy, you see them less frequently, about once a month or so. And as the pregnancy goes along, they see them every other week, and then she's now seeing them every week. So about that 4 weeks before you deliver, you see them every week. So that kind of frequency depends on where you are in that pregnancy.
Okay. And that's typically an OBGYN that you see in your prenatal visits? Okay. And how does one identify the doctor? How did you choose the doctor that you have?
I was going through Eskenazi. My primary care physician just went ahead and referred me to the OBGYN there.
Okay. And you've been happy with your OBGYN?
Well, I since moved, so I loved my first OBGYN, but I also like my second one as well.
Okay. Because having a good relationship with your OBGYN is very, very important.
Yep.
So what are some of the things that you've had to do as part of your prenatal care?
Well, in the beginning, like the first 4 or 5 months, I unfortunately had the worst times. I mean, I couldn't stop throwing up. I was ending up in the hospital left and right because I just would not stop throwing up. At first, they thought that it was the prenatal care because some mothers can't really I don't know, the medicine doesn't really help them. You know what I mean? I don't know, it just makes them sick or something like that.
Prenatal vitamins?
Yeah, they're kind of hard to, I don't know, but. They ended up giving me extra medicine to kind of help with the vomiting and stuff like that. And ever since then, it's basically been smooth sailing as far as the vomiting. Once that subsided, it's been okay.
Easy.
Seriously. Obviously, gaining weight you know, and sleeping a lot and just not having a whole lot of energy, not being able to do certain things I would love to do, but I can do all that next year, I guess. Yeah. Just basically been doing a lot of resting.
Okay, which is important.
Yes,
resting is important.
Yeah.
So Nurse Mackenzie, what else is important while you're...
Yeah, I think that, I mean, from when I meet with my clients, I think it's, I try to enforce the importance and see what they think is important about prenatal care, because I think that sometimes people are like, well, they don't do anything. You know, I hear all the time like, well, they didn't really do anything. And I'm like, okay, so what did they do? You know, and measuring your belly, and a lot of clients are like, well, they just measured it. But just encouraging them to see the benefit of, you know, and the purpose behind all of those things. So, you know, measuring the belly to see if you're growing based off of how many weeks they say you are, and so they can see that the baby's, you know, growing appropriately, and listening to the heartbeat, which I know Amber and every client loves to hear.
That's exciting.
Gives that reassurance. And then a lot of times too, that those labs and you know, getting those vital signs, the very concrete data of just making sure that you know, there's no infection and the blood pressure is okay, and checking for all those things.
So even though we may feel okay, or we may think everything is okay, really important to go to the doctor to do all of those extra things and tests to make sure that everything really is okay, and that we're healthy. Because as a mom, we have to stay healthy
for the baby
too, to make sure that the baby stays healthy. Prenatal vitamins should start when?
As soon as I found out I was pregnant, they gave them to me. I mean, a lot of mothers, they lack certain things. Like, I'm hypoglycemic, so I'm low in a lot of things. So I really feel like the vitamins definitely boosted the, you know, and ensured her health. You know what I mean? So I definitely think that as soon as you find out you're pregnant, you should definitely get on them. Some mothers that aren't breastfeeding, they recommend to, like, I guess they, you know, they just stop you right after you have her, or him. But breastfeeding, you're supposed to continue taking the vitamins. So, I mean, they're important big time during pregnancy.
They are. They're very good for you, and they make your nails grow, and they make your
Your
hair grow. And I was like, can I keep taking these? Yeah.
That's how I feel, really.
They're very good for you. I was like, my hair has never been so long. So tell me a little bit more about your experience in working with Nurse Family Partnership, and what other areas they've helped you in throughout your pregnancy.
Just general information that I did not know about. Like I said, I mean, this is my first child, so I mean, and I really didn't have like any other resources or support, I guess I should say, to lean on. I mean, I do have a couple siblings that, you know, have done it, but we're just not really that close. So with having her, it's been awesome. Like I said, like, she's just helped me out tremendously with so many different things. Can't really think of anything right now because my mind's so blank. But just, I could not have done this without her. Like, seriously. I was so nervous in the beginning when I first found out I was pregnant. I didn't think I could ever get pregnant. I'm 27, so I just pretty much thought, you know, it wasn't going to happen for me. So, but she's helped me out tremendously through a lot. And I think that she's very important. Honestly, I'm going to go ahead and say everybody should have a nurse, really, because, I don't know, it's just, if I needed something, if I had a question, I could call or text her, and she could answer it right away, versus getting into a doctor takes, you know, a little bit longer. So.
Okay, good. Well, that's great to hear, and I've heard a lot of really great things about Nurse Family Partnership in the community, and it's, you know, when you're pregnant, you need that support. You need help. You need somebody that you can call, whether that be your mom, your grandmother, your aunt, a nurse, whoever. Somebody always needs any of those. Yeah. So having,
she's been awesome for that.
Good deal. What are some things that take place in prenatal care that help prepare moms to be moms later down the road?
So prenatal, that helps them be a mom. I think that, you know, in the pregnancy period, let's say, you know, and what they're, you know, learning about eating healthy and kind of taking care of their body, that kind of starts in pregnancy, which kind of develops an ownership of being a parent. I hear a lot of times how, you know, lifestyle changes when they're pregnant, and that's solely for the benefit of their baby. And so I think that, you know, as a parent, I'm not a parent, so I don't know, but I think that as a parent, you learn, you kind of have this idea that your child is the number one thing, and so I think that when you get prenatal care and learn about how to best take care of your baby, you make a lot of changes in your life and I've seen Amber make to just
life kind of ends as theirs begin. I mean, so to speak.
Your old life
to a certain point.
Changes.
Right.
Yeah, exactly. It's a big change.
What about if you're smoking,
For 18
drinking, drugs during pregnancy? Good thing, bad thing?
Oh, definitely bad.
Okay.
I don't even think I'll ever have her around anybody that smokes or drinks or anything, just because I know, it's not good for her health. And I don't want her to think it's okay, you know what I'm saying? So definitely going to be a big, I don't know, I'm just going to definitely try and keep her safe from the world, basically. Yeah. And that's a big part of it, so.
It's the biggest job you'll ever have. Tell my daughter that, or both of my kids, that my job, above all else, is to keep them safe.
Yeah.
And all the rest of it's easy. Loving them is easy. Nurturing them, playing with them, easy. Keeping them safe is the hard part. But that's my number one job, so it's a big one. And it really doesn't come with any kind of owner's manual either, so let me tell you. It's lots of trial and error. Yes, common sense. Yeah. Yep, it is. The world's a crazy place. What are some other things that you do with moms once baby's here? Because you work with moms until baby is
2 years old.
So what are some things that you'll do with Amber once Crystal has arrived?
We really, our whole focus is not only just child development, but just developing that bond. And so we do a lot of interactive things with the mom and the baby, and so we have we call them pipe lessons. They're parent interactive lessons, and where I would model a concept with a doll, which I don't know if you know this yet, but then she would do that. Okay, she would do that with Crystal, and so it kind of that just the concept of, let's say, attachment and how a child learns attachment by one person, and so it's an easier, I think it's a better hands-on way for someone in that one-on-one interaction to learn, because they can practice and they can see how their baby responds, and then we can talk about okay, so what kinds of attachment did you see in your baby when we were doing that activity, or stuff like that.
Okay. And what about breastfeeding? Is that something that's
we definitely start that very early. Okay. We actually just our program did a huge breastfeeding initiative where we encouraged all of our nurses we're all CLC certified.
What's CLC?
Certified lactation counselors.
Okay.
So it's a step below the consultant, the actual train. It's just a 40-hour training.
Okay.
So we're all trained in breastfeeding, and so we encourage all of our moms to consider it. Obviously, all moms. She's going to.
Breastfeeding? Okay.
Why did you choose to breastfeed?
Just because it's healthier for her and me. Cheaper. Don't have to worry about formula.
Yes.
A lot of different things that I found out, like breastfeeding doesn't stain when they puke, or have other it just doesn't stain their clothes at all, which is also another benefit. Basically, I think it's awesome. I also I always thought that it hurt. She's saying, that certain, it shouldn't hurt. Either the baby's not latching on right, or and a lot of moms don't know that. I've talked to a lot of moms and they're telling me, "Are you crazy? You shouldn't breastfeed." And I'm all for it. I think it's going to definitely benefit both me and hers.
Oh, good. Well, good. That is good. I was a breastfeeding mom, and it's a wonderful thing, and it takes some getting used to. It's like anything else.
Right.
It's something that you do when you do it for the first time.
Obviously something, she's going to be sucking on me, what I mean? So obviously it's going to be uncomfortable, but as long as it's not going to, excruciate, and I'm definitely going to stop before she gets teeth. So I'm thinking, maybe
they do
6
powerful
months.
things with their gums, so be careful.
I think I'll be okay.
Yeah, it'll be good. It'll be good. Good. How did you find Nurse Family Partnership?
She just gave me a call. I didn't, I'm assuming probably through my doctors.
Okay.
But, I did not look them out. I had no idea that they even existed. I didn't.
Okay.
So I was really, like I said, very happy to, hear that she was going to be coming to my home, and I didn't have to come to her. They come to you.
Okay.
Which is definitely good.
Convenient.
Yeah, convenient. That's what I
Helpful.
was trying to say. And yes, exactly. I mean, I don't have a vehicle, so with me getting bigger and bigger, it would have been harder. I don't know. I think it's an awesome program, and not a whole lot of people know about it, and I really, really think that everybody should.
We make connections with the clinics and the hospitals, and so she's going to Eskenazi. And anybody that comes through their prenatal care and qualifies for our program, they send us referrals directly. And then we as nurses make phone calls, which is, I just randomly called her. And we just tell them about our program and see if they're interested, and kind of just tell them what we're about, and
I got a lot of calls actually, but I just ended up choosing her. So.
Okay. Was there any reason in particular?
Just by what she, promoted to me, over the phone. She seemed friendly, and, I was like, well, I could definitely use someone to kind of help walk me through all this. So, I gave her a shot, and I'm definitely glad I did. So. Okay.
Great. Well, how do people find you if
they,
they're not receiving prenatal care and they're not already hooked into a hospital or a clinic and they need your support?
Yeah, totally. We have a website, goodwillnd.org/NFP, or we have a phone number that they can call and make referrals directly. Or they can ask if they are getting prenatal care, they can ask their doctor. Most doctors we've made connections with and know about our program, and they can send referrals in.
So that would be the first thing we would say to our guests, is if they're not receiving prenatal care, they need to start that immediately. Because that's very important and has lots of health benefits for both the mom and the baby. It's really important, and folks should not just make assumptions, again, that everything is going to be okay, or they're young, or they're healthy, because there's a lot of things that we don't know walking around that could be going on in our bodies that are impacting the baby. So that's really, really important to get connected with a healthcare provider. What are some of the eligibility criteria? I mean, who is or who is not eligible for the program?
So any first-time mom.
Okay, so
first-time mom, less than 28 weeks pregnant.
Okay.
Live in Marion County and qualify for Medicaid. Okay. So those are kind of our top 4 criteria, and we're still taking referrals. We're nearing capacity, but we're still taking them.
Yeah, I was going to say, I know you guys have grown quite a bit
in the
last couple of years, so for a fairly new program. So, I mean, as a social worker, I have to kind of throw it out there that Nurse Family Partnership is a program that's been around for 35 plus years. It's new to our area, but and it's a program that's been very well researched and has been shown to have wonderful outcomes for both the moms and the families that participate in the program, but also for the babies. So for my effort focused on the prevention of child abuse, neglect, and delinquency, we know that parents that are connected to Nurse Family Partnership, their kids are doing well, their kids are safe, they're healthy and happy, they're going on to college, and all of those things that we want to see for families. So it's really great, Amber, that you got the call and that you accepted the challenge to be a wonderful mother and to allow Nurse Family Partnership to help with that, and for you to utilize the resources that are available in your community, because that's really important. Like you said, we all need help, we all need assistance and support, and that can come from all different kind of ways and people and at different times in our life. So as a mom, I commend you for that, and you'll need lots more of that going forward. So just keep an open mind. But I thank you both for being here very much and for sharing all of this great, wonderful information. Appreciate your time, and thank you. So, and I thank you all for watching another episode of Our Kids, Our Families, Our Communities, and we look forward to seeing you again next time.